We have Her Excellency Ms. Arena Tundra, who is the High Commissioner, Acting High Commissioner to Australia. We have Ms. Verity Hawkins, CEO of the Cancer Council. It's been a big day for you, Verity.
It has.
We have McGrath Foundation's Marie Yang. We have Dr. Boniface Pache. We have Kanti Gina who's the community leader. And we have Tika Ravatuma from Finance. Welcome to all of you. Thank you, please. First of all, the players, both sides, captained by Robbie Trickett and Prince Peru. A couple of players have made a particular effort to get here. We've got Aidan, who's come from the Central Coast side, who's from Sydney. So thanks very much for the effort. But certainly not planning to be the last Canberra's own World Cancer Day event. It's incorporating the Peace Day, as most of you know, is World Cancer Day today, and a very good cause. All the money that's been raised today is going to the Cancer Council and the McGrath Foundation, which are really, really causes. So a couple of thank yous. Kids, umpires, fantastic job of the great pressure today, guys. Thanks, Canberra, Jeff and Megan, really well done, guys. This was done at pretty short notice. Thanks very much for being able to put on the pitch and have the field looking great. It is probably the best outfield in Australian cricket. It's magnificent to look at and probably on plan as well. There's Mega Man from Barza Consulting, and we also two more our commentators today. Besides the cameo from Mr. Trickett, we had Santosh and Manish, who were very well known. So thanks very much. There are a few organisers for the events, really well done guys, again, particularly short notice. Along with Natasha, Sam Murphy, Sam Deschamps, and Shashi Sam. You can please invite Sam Murphy to come and say a few words to everybody. Thank you.
Good afternoon, everyone. Before I start, I've been trying to be available in the language of my culture. So, Manawari, So, thank you. I just let me go back to why we are celebrating. Way back in 1973, between the two world wars, Western Europe was fighting for survival. But they were not only fighting for survival, they were fighting against the then known as cancer. So way back in 1923, the International Union or International Control over Cancer, control, if they decided they were defeated back then, control, become cure, they will control. So control for cancer started in 1923. Then right after Second World War, and looking at today, many people ask me, even in the ABC radio, 24 hours ago, they asked me, oh, you are an Indian, and what made you start this cancer? So I corrected the ABC journalist. It is not Indian. Cancer doesn't discriminate nationality, ethnicity, which part of geopolitics you play. Cancer, if anything, unites all as it has done today. Number two, if I go back to Australian and Indian contribution to the World Cancer Council, 2 hours ago I found a fascinating data that's Google research. India was the first country in 1958 to 1962 to head the World Cancer Council organization presidency. And then 36 years later, Australia took the presidency of the World Cancer Council from from 1994 to 1998, and 2018 to 2020, and then 2020 to 2022, India remained with the presidency of the World Cancer Organization. And now, it's only fascinating to know that India and Australia have played a significant role in the international level for cancer contribution. Perhaps the McGrath Foundation is the pinnacle, is the icing on the cake what the McGrath Foundation has done in the last 2 decades. So, when somebody asked me why this event, my inspiration started from year before last year when I met a gentleman, Dr. Manuka. He, again, sorry for the pun, he single-handedly walked 4,600 kilometers over 3 years at the age of 72, 73, 74 to generate $138,000 for the McGrath Foundation. And when I asked who is going to walk 4th year, he said you. Well, I couldn't. Later, because McGrath Foundation switched from breast cancer charity into all cancer, this year marks a significant transformation of McGrath Foundation, the ability to create awareness from breast cancer alone to all cancer. So they requested me, instead of you walking from Melbourne to Sydney, why don't you have an event in Canberra, because you are a Canberra, you are from Canberra. And when I had that idea, whenever I have this adventurous, mischievous idea, I always go to my good friend Arun of 42 years. And when that happened, that was 3 or 4 days to Boxing Day last December. So from there, within the 4 or 5 weeks, here we are. We thought we will have Canberra's
all the best.
James McGrath Day event. Canberra's own World Cancer Day, bringing academia, research foundation, oncologists, doctors, medical professionals, children, to educate all of us. And then add a physical and mental, if you like, health, which brings the sports into picture. So sports is a complementary process, but World Cancer Day is our ability to unite ourselves to fight against the world's leading cause of sufferings. So thank you, and I will hand it over to Mike Paul to continue.
Thanks very much, Sam. It's definitely a worthy cause, and it's great to read from time to time for eliminators of cancers, and breast cancer would be a very nice one to get rid of. Now, speaking of cancer, being World Cancer Day, a lady is going to come in and say a few words. She's been on the go since I got on the radio at 7 this morning, so it's probably been a long day. Very important, the CEO of Cancer Council.
About 2 weeks ago in our office at Cancer Council ACT, I was absolutely bowled over, no pun intended, by the passion that they demonstrated and their commitment to putting this event on. And I'm absolutely thrilled that Cancer Council ACT can be a part of it, along with McGrath, and that we're really here in the ACT making sure that our presence is known, that we really are here to support Canberrans and those from the surrounding regions. With almost 1 in 2 Australians diagnosed with cancer by the age of 85, it really does affect all of us, and that's just not a statistic that we can ignore. So today we've really been focusing on our supportive care team, being at the Canberra Hospital today and being out in the community, making sure that we are there to support people. Whether you've received a diagnosis, whether you're caring for someone who's going through cancer, whether you've lost someone to cancer, we're here to support you. And really the diagnosis touches everyone in a very individual way, and everyone is affected individually. So it's very important to know that support is available and where to come and find that support. So that's really what we want the message to be today, is that Cancer Council ACT is here locally and that we want to support you. We've got an amazing team with our prevention team. They're here today as well, promoting sun smart behaviours and just reminding you all that the UV is extreme in Canberra in January and February, so please remember your hats when you're out and about and sunglasses and look for the shade. We're also doing a lot of work in research. We support research that's being conducted locally, whether it's at the ANU or UC. We have some amazing projects that we fund, and that really does link into our vision of a cancer-free future. And none of this would be possible without the support of all of you in the room and all of our donors and people who leave us gifts in wills and those kinds of things. It's thanks to those people that we're able to support as many people as we do. So thank you all, and thanks again to Sam and Arun for having us.
Thanks very much, Drew. We're now going to hear some words that have been pre-recorded, I believe, from Tracy Bevan, who's with the McGrath Foundation. I'm presuming modern technology is going to appear on your screens up there. Perhaps not. We thought okay, in lieu of Tracy, we have another representative from the McGrath Foundation here today, who's a McGrath care nurse. Maria Leanne is going to come and say a few words to us.
Hi, and thank you all for being here today to mark World Cancer Day and to raise awareness and funds for the McGrath Foundation and Cancer Council here in the ACT. Here at the McGrath Foundation, our purpose is to ensure that no one goes through cancer without the care of McGrath Cancer Carers. The foundation itself was set up 20 years ago by Jane McGrath and her husband, as we all know, the Australian cricketer, Glenn McGrath. Jane's public experience with breast cancer and the impact of her own breast care nurse set out the mission of the McGrath Foundation to ensure that every family experiencing breast cancer has access to a breast care nurse, no matter where they are and where they lived, for free. In 2008, Jane actually passed away from breast cancer, and at that point had secured funding for 50 breast care nurses. Last year, the McGrath Foundation celebrated its 20th anniversary, and it announced it was taking its care to all cancers. Our goal is to be able to help 1 in 2 people diagnosed with cancer in their lifetime. At present, we are funding for 343 McGrath cancer care nurses across Australia who are all experts in nursing care. We have supported over 167,000 people and their families across Australia. For me, as a McGrath cancer care nurse, I understand how complex and challenging a cancer diagnosis is. My role is to provide the clinical, psychosocial and emotional support that is much needed to patients and their families affected by early stage lung cancer here in ACT and as I am based in the Canberra hospital. I'm also privileged to work alongside 3 McGrath breast care nurses. And together we help our patients make informed decisions about their treatment and provide evidence-based information and support, from diagnosis throughout the treatment to the living wellness of action phase. We know that the earlier our patient access a McGrath care nurse, the better the outcome will be. For me, it is an absolute privilege to be that point of contact for our patients and their families, and to be someone they can trust during one of the most challenging and vulnerable times in their lives. It is so rewarding to turn up each day knowing that we are making a difference to so many people's lives. And this wouldn't be possible if it wasn't for yourselves and the general public for raising funds to the McGrath Foundation. So on behalf of the McGrath Foundation, thank you to everyone here today, and particular thank you to Sanjay Sharma and Samba for organising today's Kingston's Fest. Let's continue to take our care to all cancers.
much, Marie, and thank you so much for the good work that the McGrath Foundation do. And look, just a special thanks at this point in time. The McGrath Days, Day 3 of the Sydney Test. Thank you to the English cricket team for lasting 3 days this time. Very kind. We're now going to hear from Mr. Kanti Gina, who's one of the Canberra community leaders.
It might be useful. Good afternoon, Your Excellency, High Commissioner for Fiji, Deputy High Commissioner for India, ladies and gentlemen. Someone once said statistics, and damn lies. Well, statistics may be damn lies, but they have a lot of truth in them. And one of the truths is that when Jyoti and I came from Fiji to live in Australia in 1982, exactly 44 years ago, on the 30th of January this year, the word cancer was something that people knew about and said, well, you've got it, say your goodbyes. And haven't we come a long way since then? Ladies and gentlemen, I just thought that with two people who have retired from the Mint, both Samba and Arun, they've been minting money all this time. So we should be asking them, when they retire from the Mint, as you always get from your bosses when you retire from a job, they give you a whole box of money or something like that and say, thank you very much for working at the Mint. However, that's not the case. We've got a tight government in Australia. They didn't give it to them. So I request that we all dig in our own different ways to assist this organization, because it's not simple. There's also in the news that the highest statistics of deaths now have changed from the heart and the cancer deaths to dementia now as being one of the highest ones. Well, don't believe it. As they say, statistics. Once you have cancer, you've got to look after yourself and look after you. And it's our duty as citizens of this country, wonderful country, to be able to do something for it. There are a whole list of long names that are going to be spoken tonight. But the beautiful things have been said already by the CEO and the nurse that is representing the Cancer Council. I had the pleasure of listening to you last year when you were here with a man who had walked all the way from Melbourne to Canberra and to Sydney and back. And the story goes on and on. Glenn McGrath played good cricket. We still have great cricketers. Our captain at the moment is not well, but he will come back again and do his job. But ladies and gentlemen, please take it seriously. Please do your best for God and country and for you. Thank you very much, and thank you very much.